This is the human heart. Okay. It has two ventricles, two auricles. You know it, basic. Then the great vessels, they rise from the heart. Okay, the arch of the aorta and pulmonary. Now, see, this has a partition. This is known as the yeah. It's like this. This is interventricular. Now, the inner side of the heart, it is the muscular, hollow muscular organ. It has to pump blood throughout the body.
Yes, sir.
Okay. Now, that's why, see, it is not a big heart like this, but it is having the inner anatomy, the muscles,
Yes, sir.
papillary muscles. You have read it.
Yes, sir.
Huh?
Yes, sir.
Now, you just see this. Okay. Now that contracts and then opens. Then this is attached to the valves. Under surface of that opens. I used to tolerate hours for dissecting bodies in my college, but nowadays I'm getting very like allergic. Anyway, I told you these are the open heart, these are the ventricles, these are the auricles. This is the apex of the heart. Now, these are the vessels, coronary artery, and now what you have to do is this: you read it. You take the tray there, put it in this, or you come forward here, and this is the lung. Now see, this is the base of the lung, this is the apex of the lung, this is the external surface, this is the hilar surface. The hilar surface is bronchus and your pulmonary vessels goes, and this is covered by pleura. These are the ridges, that is due to the it is like this. Just telling you, just show you. See, this impression is there. That's why, hey beta. Huh? This impression is there. See, I'll tell you just. See. See. The rib, this is rib impression, the thoracic, because your that means it is in the since birth, not life before birth. When the child is delivered, then it's the lung, breathing and muscles. He has his impression will be this thing. He has a big thoracic cage, large diaphragm. Now, this rests on the diaphragm, like this. You hold it like this, like this. When you hold the specimen, this is the anterior border, this is the posterior border, and you see the impression, this is the costal surface. Este, amar ghare bosha. Now, this is the base, this is the apex, the medial surface. Medial surface, you do see, you don't hold it like this, or you don't hold it like this. এটাকে right lung বলে. But if you hold it like this, the left lung, this is the group for the arch of the aorta. This. The heart is placed here. Okay. Here. And
heart
okay. Now what I want to say is that bring your book, see, read, okay.
Yes, sir.
Just spend half an hour, at least half an hour to identify. I told you the basic things. Now you start.
Okay, sir.
Just identify the main gross structures. Okay. See, yeah. It will be under. I'm just showing you because in 3D I cannot draw it in this 3D. And you will be just this thing, and your ribs are here. In the thoracic cage. The sternum and this thing, this rib is cut. Okay. Now, see, I'm just drawing it in blue. This is the pleural sac. Yeah. This is the diaphragm. Now, the pleura is the lung. And this is pleural fold here. Over here in the hilum.